Let's switch the topic a bit to talk about what you can expect physically in a dying patient. It's almost impossible to predict when someone will die and what that process will look like, but there are several physical symptoms and emotional changes that are likely to occur as death approaches. So let's review some of the symptoms that you can expect for your patient at the end of their life. Physical changes are a natural part of the dying process and signify that the body is slowing down and preparing for death. Among the most common physical changes are decreases in appetite and thirst. Many patients refuse food and water as they near death. Refusing food and drink does not cause the patient distress, but forcing them to do so may be distressing. Increases in sleep and dozing. Many patients begin to spend long periods of time asleep or in a state of drowsiness or dozing. Patients should rest and be kept comfortable. Difficulty waking the patient. Caregivers may find it difficult to wake patients. There is no need to use a raised voice or physically rouse the patient. Changes in body temperature. The patient may feel extremely hot or cold. Patients may experience changes in temperature as their blood circulation slows. Temperature changes in the hands and feet are common. Changes in breathing. Breathing may become shallow, fast, slow, and even noisy. Changes in breathing are more distressing for others than for the patient. Saliva and mucus buildup. Due to increased swallowing and coughing, patients may experience a buildup in saliva and mucus that causes a gurgling sound in the throat. This sound may be frightening for those around them, but does not signify an emergency. Patients may experience agitation and restlessness as changes in blood circulation affect the brain and other parts of the body. Changes in urine output, smell, and color can occur, especially as patients reduce their fluid intake. Incontinence may occur near the end of life. Incontinence does not occur in all cases, but proper preparation can preserve patient comfort and dignity. Physical changes can be distressing for those around the patient, but often do not cause pain or distress to the patient. CNAs play a critical role in keeping patients comfortable during the last weeks of life. Dying can be a long process. Again, it's impossible to predict, but these three symptoms are ones that are common in the final moments. First, loss of consciousness is common at the end of life. Even if your patient has lost consciousness, you should still create a calm environment. You can speak to the patient calmly and hold their hand. Second, as blood circulation slows down, you may see changes in their hands or their feet. People with lighter skin tones may look slightly blue, or their skin can look blotchy. On people with darker skin tones, blue can be harder to see. It may be easier to see on their lips, nose, cheeks, ears, tongue, or the inside of their mouth. The skin may look darker than normal, with a purple or brownish color. Some people's breathing may become loud if mucus has built up in their throat and airways. This can happen if they aren't able to clear their airways through coughing or throat clearing. The sound that their breathing makes is sometimes called a death rattle. It usually happens in the last days or hours of life. You can try changing their position if possible. Try turning the patient to the side and place a pillow under their head and/or back, or use gentle suction. These final moments can each sound and look scary, which is why it's important that you should know that they might happen. Knowing that this is common and natural and just a part of the very end of life should help you remain calm in the situation. It can be distressing to see and hear, but if the patient's pain is being managed well, they are not suffering and are not in distress. Physical changes occur when a person dies. The dying process can be lengthy. The following signs can occur at death: no pulse, heartbeat; no respirations; no response when resident is talked to or touched. Death occurs when breathing or respiration and heart function or circulation stop and cannot be restarted. Other signs include pupils are fixed, do not respond to light, and dilated, big. Note that the eyelids may remain open. Check if pupils respond to changes in light. No blood pressure. Skin may appear unnaturally pale or wax-like. If you notice any of these signs, call your supervisor immediately. The role of the CNA during the dying process is to physically and emotionally support patients during the dying process. CNAs help individuals maintain their personal preferences and dignity during the process. Support looks different for each patient. Some patients may request additional physical support, while others are looking for an emotional connection with another human being. Sometimes the role of the CNA is simply to provide comfort and support as the person goes through the dying process. No matter what the support, CNAs should provide support within the ethical guidelines of the profession. CNAs provide much of the daily care for patients near the end of life. As discussed in previous slides, the primary role of the CNA is to provide the patient with comfort and dignity. Their role is to help patients complete the daily physical tasks that help achieve that goal. CNAs help patients with many daily tasks, including bathing, toileting, including help with incontinence, cleaning patients, providing sanitary pads, and assisting patients into the restroom. Additional personal care tasks like hair and teeth brushing can help patients feel more confident, and CNAs often work with patients to meet daily personal hygiene needs. Oral hygiene changes with age, particularly if the patient has difficulty swallowing. CNAs are often involved in helping keep the patient comfortable with moist swabs, applying moisturizer, and providing small sips of water. Many patients experience pain. CNAs help communicate pain assessment to other members of the medical team and keep medication on track. Many patients require help eating. Some patients develop difficulty swallowing as their body systems start to shut down. The CNA should communicate concerns or observations relevant to difficulty swallowing to other members of the medical staff. Patients experience changes in body temperature regulation as their blood circulation slows. Patients may feel cold or hot or shift between the two extremes. CNAs should do their best to keep patients comfortable while also monitoring patient safety. Mobility decreases as patients approach death. CNAs play a vital role in keeping patients comfortable and preventing sores and skin irritation. CNAs should monitor the environment through the light levels, temperature, and sound in the patient's room. If patients are unable to express their needs, the CNAs should do their best to keep light and volume low. Communicating with your dying patient is incredibly important. Because you may be the only person that they are able to express themselves to, be sure that they can communicate with you and trust you. Studies have shown that better CNA communication was associated with better performance in the end-of-life care process. You can also make a difference through showing compassion. You can do this by listening, supporting, and reassuring your patient. Listening and supporting means being there for the patient and meeting them where they are. For example, if the patient would like food but is having a hard time with swallowing, help them to eat only small portions or make sure their mouths are moistened. Listening to the patient includes listening to their medical needs, but also listening to them express their feelings. Often patients are scared, frustrated, stressed, and you can lend an empathetic ear. It can be hard to know what to say in these moments, but that's okay. You can role play and practice what to say if you're nervous about this. Ask a colleague what they find helpful, and perhaps ask if you can practice with them. It's also okay to admit that you don't know what to say. It's not as important for you to speak. It's important for you to listen, show empathy, and reassure. Compassionate communication can make a big difference in the quality of the patient's dying process. Reassurance helps patients through the process. Most likely, they do not know what to expect, and they may be worried, stressed, and anxious about what is happening. Make sure that you reassure them that their process is natural. Communicating with your dying patient is incredibly important. Patients will trust you. This can be difficult if it is a situation where you must wear personal protective equipment, PPE. Just as you would with other patients, it can be helpful to explain to the patient why you are wearing the PPE and to explain what you have on and what it does. If possible, point out your name tag to them and show them the photo on your ID so that they can imagine your face without the PPE. If your facial expressions are hard to see with your PPE, explain what you're feeling to them. Make sure you have eye contact as you're speaking. You'll also want to make sure to give them comfort, which can be as simple as speaking to them soothingly, massaging their back, or holding their hands. It's okay to say nothing at all. Sometimes patients just need the silent comfort and reassurance of your company. Palliative and hospice care are two forms of end-of-life care. CNAs are an important part of both these care teams. Both provide comfort care, and initially these types of care appear similar. But there are some subtle differences that impact the daily duties of a CNA. Palliative care centers around individuals with a serious medical condition that requires additional care and monitoring, often in the hospital setting. Palliative care can begin at any point after the initial diagnosis and can happen alongside curative treatment. Hospice care, on the other hand, provides compassionate care for those with a prognosis of 6 months or less. Another important distinction is that hospice does not provide curative treatment. Hospice care can be provided wherever a patient calls home. CNAs are important members of end-of-life care teams. Your role as a CNA includes several things and begins after the patient has been declared dead. Post-mortem care is taking care of the body after death and is done to maintain a good appearance of the body. Each facility has its own policy regarding post-mortem care, so you should find out your facility's policies and perform only those tasks that your facility asks CNAs to do. Some of the common duties include: when someone dies, it's important to the family to treat the body with dignity. You can do this by addressing personal hygiene. Wash their body, comb their hair, and cover their bodies with a gown or pad. Within 2 to 4 hours after death, rigor mortis develops, so it is important to position the body in a normal alignment before rigor mortis occurs. Position the body in the supine position, legs straight and arms folded across abdomen, with one pillow under the head. You should understand that as you move the body, air may escape from the lungs and are expelled from the intestines, causing sounds to be heard. Do not let these sounds scare you, as they are normal and to be expected. If family members would like to visit with the deceased, provide privacy and close door quietly. Try not to rush the family members. You may be worried about what to say to the family, but remember that it's best to be sincere. A simple "I'm sorry" is enough. Avoid the non-therapeutic response of "she is in a better place" or "it is for the best." Instead, you can say something like "your mom will be missed here" if it is true. This response is both kind and supportive. Patients are people, not a series of tasks to be completed. Your job at the end of life is not to cure the patient. It is to keep them comfortable and calm and make the process dignified and comfortable for them. As a CNA, you play a critical role in supporting dying patients. You show respect to the patient as a human being while providing physical and emotional support during the last phase of life.